Hello to everyone in Maryland's beautiful congressional district, our friends from across the state and even across the country. The 2022 theme of Black History Month, which we're still in, is health and wellness. And to close out the month, we have invited staff of the African American Health Program in Montgomery County to share critical information with us about their services and their continuing outreach to the community to make us all as healthy and well as possible. The program's explicit mission is to end health disparities and to increase both the number and the quality of years of life for African Americans and people of African descent who live within our community. The program is within the Montgomery County Department of Health and Human Services, and it is run by McFarland and Associates. And here with me today, we have several guests who are essential to the success of this program. One is George McFarland himself, who is the president and CEO of McFarland and Associates. Second is Dr. Nkase Dambita, who is the African American Health Program's clinical director. Serena Holtz, who is the SMILE nurse case manager, and we're gonna get to hear from Serena about SMILE. Brandon Estime, who is a community health worker with the project. Arle Wallace, who is the Montgomery County Department of Health and Services African American Health Program manager. And did I cover everybody? Was there anyone else who accompanied you guys or no? I think I got everybody. That's it. All right, terrific. Then, well, let's start then with George, if we could start with you, and you could give us an overview of the project and tell us exactly what's been going on, what's happening, what are the successes, and what are the challenges you're facing.
Well, first of all, let me say thank you for this opportunity. And I want to again echo what Dr. Dambita started off by saying about the outstanding representation that you do for not only Montgomery County, the state of Maryland, but also the nation. I want to say that this is an extraordinary opportunity that the Montgomery County government has invested in the African American Health Program to help reduce the disparities in health that exist not only in Montgomery County, but also throughout the nation. We think that the lessons we have learned over the past couple of decades can be very instructive to the nation, because when we look at health disparities, we look at the legacy of racism and discrimination nationally, and we have seen most pointedly the impact of that discrimination in the current COVID-19 virus pandemic. We know that people of color have been disproportionately impacted in terms of hospitalizations and deaths. So what we think is that what we clearly know is that there are a lot of things that we have to pay more attention to if America is going to achieve the promise that has been expressed for decades. We focus a lot on physical health. We focus on giving people the knowledge, the skills, the information, and the tools to live healthier and longer. We pay a particular attention to the leading cause of preventable premature deaths, such as cancer, cardiovascular health, diabetes, HIV and AIDS, infant health, oral health, and mental health. We know that there's a confluence of factors that predisposes people to premature deaths. We focus on physical health, emotional health, social health, intellectual health, spiritual health, and access to care, as well as providing health screenings and health care utilization. We pay attention to all these factors as we try to close the gap. At the end of the day, we know that people of African descent in Montgomery County are blessed that despite the gap, that they live healthier and longer than most of the rest of the nation. So I'll stop at this time.
Oh, what a beautiful introduction. Thank you so much for that. Dr. Dambita, I wonder if you would go next and describe can you give us an overview of the services and the kinds of information that are made available to the population you're serving?
I'd be honored to do so, Representative. What we do, we prioritize actions that have the greatest impact and require the least amount of resources. So we practice a strategy of proximity. We meet our target population where they stay, where they pray, where they play. So we are out in the community and bringing them services. What are the services that we bring to them? We bring community and in-service screenings for services, screening for diabetes, screening for cardiovascular diseases, confidential screening for HIV, and anonymous screening for mental health. And we also focus on disease management. As you see, the picture here is focusing on preventive services because they require the least amount of resources. And we offer disease management for those that we were not able to assist in preventing some of those diseases that I mentioned. So we provide education. It could be through nutritional education. It could be through what to do to stay healthy through exercise, changing some behaviors that are negatively affecting the health of our people, and offering a wide range of referral to services that are available to them, either through the private sector or through the county of our government. One service that we focus on is preventing maternal death, preventing infant mortality. And we provide tools and support that aim to improve the likelihood of healthy pregnancy outcomes. And we send our nurses, they offer home visitations when that was possible. With COVID, we shift gear and move into a teleconsultation. And after providing risk assessment for each pregnancy, we intensify the kind of intervention that a particular pregnancy would require. All this aiming to a favorable outcome for that pregnancy and staying with the mother and child until the age of until the age of 1 year old. And then we attack social determinants through a series of services. The needs for housing, the need for employment, the need for insurances. We have our staff social worker to focus on those areas and assisting people, because if they are able to resolve those issues, they can be in a better position of taking care of their health. So that's in an overview of the services that we offer. And in terms of disease management, we also give the opportunity of monitoring our clients remotely, whether they have diabetes or high blood pressure, and receiving feedback almost immediately in real time. And if there are any dangerous levels of their indicators, we're able to provide the educations that they need.
Wow, that's just awesome to learn about everything that's going on there. And we'll make sure that people know how to get in touch, because, I mean, you really cover the waterfront there in terms of the different services provided. If I could come to you, Serena Holtz, one of the things Dr. Dambita mentioned was infancy and making sure that people get the best possible start at the dawn of life. Tell us about the SMILE program, if you would.
So we have the SMILE program, Start More Infants Living Equally Healthy Lives. And we believe that if you have a healthy mom, you'll have a healthy pregnancy, and you'll have a healthy baby. And so what we do is educate the mom during her pregnancy on how to take care of herself, make sure that she's keeping all her doctor's appointments, that she's eating correctly. We really stress that they get vaccinated with the COVID vaccine, because we're finding out from Dr. Fauci that if they get that vaccine during pregnancy, it will help immunize the baby. It's more effective that way, instead of getting the vaccine after pregnancy and thinking that it's going to come through the breast milk, which it does not. So we make sure they keep their doctor's appointments. And after the doctor's appointments, we usually call them, or they call us, and then we discuss those visits just to make sure that we're all on the same page, that they've understood everything. We also have mommy chat on Wednesdays, which we're going to do today at 2:00. And it gives all the moms a chance to meet the nurses, all the nurses and the social worker, and we address different issues that the moms might have questions about. And we also see to the mental health needs. If there's anything they need to discuss, or if they need professional help, we make sure they get that. Also, if they need things like car seats, pack and plays, strollers, we do distribute those. If they need clothes, sometimes we have donations of clothes, and we're able to do that, distribute that. A lot of our moms we're finding need housing. They're having problems with housing. So we try and get them over to the HOC in order to, work with that. And then we take care of the babies. We used to do home visits. Unfortunately, with the pandemic, we can't do that anymore. But when we do a home visit, we walk in, we weigh the baby, we weigh the mom, and we take the mom's blood pressure. And a lot of times, if there are other people in the home, we take their blood pressures too. And we talk to them about diet, nutrition. We let them know about our program that we have for pre-diabetes and for diabetes. So we, kind of bring them in full circle to the African American Health Program. And we make sure that they are taking care of their children as far as car seat safety, making sure that the home is safe, making sure that the babies are getting their proper immunizations, and that they're meeting their milestones, and that they're in a safe environment.
So if I'm a pregnant mom, am I finding you, or are you finding me?
I'm sorry?
Like, do I find you, or do you find me if I'm a potential client or potential participant?
Usually people are referred to us. We try to get into the community. We're, anytime there's something community-based, we're out there, church-based, all those types of things. But from the WIC program, WIC will refer people, DHHS, they refer people, word of mouth. So, and also we've been on the radio, Dr. Dambita, Mr. McFarland and I, we've been on the radio too. So, we're out there doing the best we can to get people to come into our organization, because we love people, we love to help.
Amazing, amazing. Well, you make it sound very enticing, and I'm going to make sure we pass the word on to anybody we know who could benefit from it. Brandon Estime, let me come to you. You're a community health worker. Tell us about what it's like to work in the community. And, we've heard about a bunch of these outreach service projects. It's one thing to take people's blood pressure or even do like a blood test or something. How are you doing outreach about mental and emotional health, if you could include that in your answer?
Yes, definitely. So one big thing that we focus on when we're out in the community is getting the full picture of someone's health. Not only when we're doing a blood pressure test, not only are we doing their blood pressure, but we're talking to them. We're finding out if they have any stressors in their lives, what are some health complications that they have that we may be able to address. So we really do a good job at referring people to other programs and within our program. So for example, if we see that a person is struggling with their weight management, then we have a weight management program that we can refer the client to. If we know that a person has recently had a death in their family, we have a social worker who we refer them to. And the social worker does a really good job at making sure that all their needs are being met. So we really try to get a full picture of a person's life when they're in the community so that we can best connect them to other programs within the African American Health Program. So really just having a strong picture of how we can help different clients and really working to address that.
But how is your work as a community outreach health worker changed because of COVID-19? I mean, is it mostly virtual contact that you're doing now? Or are you still out in the community physically?
Yep. So it definitely has changed. We do during the pandemic, we have been in the community to some extent, not as the same extent before the pandemic, but we've done a lot of outreach calls to different participants. We also have another community health worker who connects people to food resources in the county. So even though we're not able to physically interact with them as much, we connect them to other resources in the county that are still providing services that they can go to. And as Mr. McFarland mentioned, we have a remote patient monitoring program where different patients are assigned a device where that automatically shares readings to a portal that we have access to. So we can continue to provide counseling, feedback remotely to patients based off if they have high readings for blood pressure, glucose, high weight. So all of our work is still continuing, and we're still reaching the community, but the methods of how we are interacting with them have changed.
Well, thank you so much for what you're doing, Brandon, as well. Arlie Wallace, tell us what difference does the work of this project make in Montgomery County? Is there a way to quantify it or measure it?
Yeah, well, I can. Well, thank you, Congressman, along with your staff for having us. There is a way we have set forth when the county put together the request for funding proposal. We list a different sets of measures that we would expect the vendor to be able to reach. That will deal with things that would focus on A1C levels, blood pressure control, the eliminating the number of low birth weights. And we looked at the data that has existed over time. So on a periodic basis, we're looking and tracking and following the progression and looking at any type of changes that we see that the program has had the influence to improve, maintain, or in some particular areas, there may be some chances where we will see some increases, and then we attempt to try to give the resources and information to the vendor to say, let's take a look at how you're actually doing things to see if we can even improve it any more to try to mediate those type of issues that we see in the community. Because we know historically, just due to the diverse population of Blacks in Montgomery County, you will indeed expect to see some changes just as the population itself is changing and getting older and just moving. So you have a lot of that that's take place as well.
Can we say that the project has actually lowered the blood pressure of Montgomery County?
Well, that is one of the measures that we do indeed submit as far as our overall performance over year. We do see some lowering with the blood pressure, but we will also tend to see some spikes. And those spikes could be due to anything from war, loss of loved one, loss of unemployment. And of course, we can definitely see what happened with the higher level of stresses that has been put on us, at least for the last number of years, knowing how the chronic disease is so prevalent within the Black community of Montgomery County.
Well, one of the things that George mentioned at the beginning was looking at social health in addition to individual, physical, emotional. And I've come to believe that that is a key concept, the idea of social health, the health that we all have in common. But what can be done about that? How is this project actually improving our social health?
Well, I can tell you there's different ways that I believe that we've been able to come together in social health in regards to at least educating the individual about the various type of programs that are truly available that really has an influence on one's health. I think we have to be there to educate people about the housing that is available, where there's rental services need, where we can even direct people to go in if it's their skills level that needs to be enhanced. If we know that there are some issues with people unable to access services due to the transportation issues that we face here in Montgomery County, we can then be the driving force that is in the community, listening to the clients, visiting, and we can actually see for ourselves some of the visual infrastructures where we need to make some serious improvements in the county so that we will not have people to have those barriers to exist. And I think another way in which we can also do that is by really establishing different forms of social support type of groups. We have been instrumental in doing that and coming up with like the Brothers to Brothers program that they have not mentioned. They talked about the Mother's Mommy Me. We've also had things to put together to have raffles, engaging people out at various social events that would also enhance their social skills so that people can know, be aware, and connect and understand more about the breadth of services that Montgomery County really has to offer.
Yeah, well, that's incredible. I could talk to you guys all day about what you're doing. It's amazing. But George, let me ask you to conclude. How can people learn more about these services, or if there's something specific they want to get in touch with, how do they engage with you guys?
Well, first of all, let me say that we have a very robust website that they can go to, aahp@montgomerycountymd.org. And also, I want to just say something about mental health. I know that's an area that is near and dear to you and all of us. And what's unique is that we have screening tools out there that a person can look at themselves in the mirror, sort of say, am I depressed? Am I experiencing anxiety? And you can do that within the privacy of your own home. And if your scores outside of the normal measure, then we give you a list of resources on where to call to find help or where to get help. And also, I want to say that this is really truly a collaboration between the vendor, the contractor, and the County Department of Health and Human Services. And when we can't find the services we need through our efforts in trying to work with the county sources, we call Arlie, and Arlie will see if she can get those doors open for us. And a lot of the capability that we develop and also the engagement that we develop comes as a result of building trust with our clients over time. This year, we've been able to get health insurance free of charge to about 35 families who otherwise would not have had insurance through a collaborative effort with the Kaiser Foundation. So we are proud of that because for the first time, these families will have access to comprehensive care at no cost to them. And we see this as a big effort in terms of reducing health disparities, not only in the county, but as a measure for the nation to take and learn from.
Well, look, I want to thank all of you for your exceptional work addressing health disparities to make sure that our entire population gets its physical, its medical, its mental, its physical, its social health needs met and addressed. It's hard to think of any more important work than that. So thank you all for what you're doing every single day. Please keep up the great work, and I'm sending you all my best.
Thank you.
Thank you
Thank
so
you for having
much.
us.
Thank you.
Thank you.
Thank you so much.
We appreciate you.